Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, we have turned the page, folks, August 1, 2011. Things have remained pretty hot around here. Things will heat up this morning. We're going to return our conversations to MCG testing today, about half past the hour. We're going to get with Jeri Singleton. We have the August 25th date already. Well, it's down in history books, folks, and many of you have responded. We'll have an additional date in September, so those of you that just don't have an open slot on the 25th, looking to be able to get this testing done either for follow-up or for your first time. I told Jeri when I was on the phone with him just a moment ago, look, Jeri, come in with a September date so that we'll be able to announce it, and hopefully we'll do just that this morning, talking about MCG testing and how they may very well benefit you from the perspective of knowing more about you without any invasiveness or terrible side effects from any other kinds of testing along that line. Well, if you know about MCG testing, you already know what I'm talking about. But if you don't know anything about it, you want to stay tuned and listen today as Jeri Singleton and I meet up with you at about half past. Now, turning the page as we've done into the month of August, guess who'll be here on Wednesday? None other than Dr. Vavoom herself, Susan Smith-Jones. Now, she's going to continue where she left off last time and probably not miss a syllable. I mean, the woman's just so on cue. But she had a list full of natural remedies she was working herself through when she was here with us last, and that was way back on the 6th of July. So it's just about a month later. She now returns to go over all the remaining ones, and there may be some others above and beyond that that you may want to bring to the plate that we can all sample. Susan Smith-Jones, our guest on Wednesday. Now, as we move along the month, as it looks right now, these are the up-and-coming guests and events. On the 15th, Doug Inglesby will be here, talking about low-cal diets and whether they're making and driving you crazy or not. Doug Inglesby has been a guest here many times before. His family very much entrenched in the vitamin industry, probably one of the initial fine lines of products coming from his family's company. Doug will be with us on the 15th. On the 17th, Lonnie Birmingham comes here to discuss heat, the #1 killer of all weather hazards. And, if there's ever been a time that may be a timely topic, certainly the month of July was. And August is starting out with a roar, too, and usually it is our hottest month of the summer. So we're talking about heat issues with Lonnie on the 17th. On the 22nd, Roland Thomas returns. Roland, of course, is an associate of Dr. Michael Kiriak. Dr. Michael Kiriak is the inventor, the discoverer, and the continued manufacturer of this product that we support here with our full force and reputation behind it. Bioengineer algae concentrates. I call it the best single supplement I've ever seen in my entire career. I think so much of it that we carry it here. Very difficult to find. A little more on F3 in just a moment. That's they have 3 different supplements the company does: F1, F2, and F3. And F3 is the most algae-packed of all of them, and consequently is certainly the startup supplement for every single one of you. I've got some information on free DVDs and books as long as they last for those of you who do purchase this drug. drug, not a drug, supplement. Also, too, in the month of August, as you would already know, we've already set the 25th aside here in my office for MCG testing. Now, it's a dual role, and so those who've been involved with MCG testing in the past, we had just a tremendous way of getting high volume traffic through the office. In fact, we scheduled one every 15 minutes and just about reached 32 in a day in an 8-hour period. So it's going to shift gears a bit, because not only is this testing for MCG for many of those who are needing to do their repeat testing, it's also our training session. So we're going to really limit the number. It's not going to be every 15 minutes. We're going to be having like once every 30 minutes, and even more so, to allow for us who are being trained in the use of this device. Ultimately, after next month, we'll be carrying this on ourselves at all times. Mr. Singleton won't be involved at all. So this is our training session. Certainly, you're not going to suffer because of our training. It's just that we're going to be slowing down and not doing so many patients at any one given day. That pace will pick up as the year moves on. Certainly by the time October rolls around, we'll be back to that pretty quick pace of doing one patient every 15 minutes, and then we will fill up the schedule and have 32 in any one given day. Then as I flip the page, it'll be a bit yet still until Dr. David Brownstein returns, but he's out in the vacation realm with his family this month, as many people are, and he's consented to come back with us on the 16th of September to continue discussion on salting your way to health. If that seems like a novel concept to you, then you obviously missed last month's dissertation on the topic. As it turns out, you take the right salt, you could and should be getting some benefits that you can't get any other way, and to the extent that that is in favor of your health and not in harm to it, may be a new concept to you, but that's what we bring you here. A completely new group of concepts at all times. Speaking of new and groups, we consider ourselves a medical boutique here. We usually handle one-of-a-kind type of product here. And as it has mounted up in the last couple of months, I'm going down through a list. I will mention to you, we do and probably are the only people who have and can distribute for retail sales these RTD dressings. I've had a couple of diabetics just really improve tremendously with a wound. If you've looked on the skin surface, there's hardly even a mark there. But the kind of ramifications that develop from diabetic getting any type of wound, especially in the distal extremities, can have devastating consequences. So any diabetics out there, please consider purchasing RTD dressing that you can keep in your medicine cabinet to be able to allow you, at any instance that you develop a wound from whatever source, that you'll be able to put the appropriate dressing on that wound and actually get a antimicrobial benefit that you heretofore have not been able to obtain by the use of standard dressings, because it's just been placing gauze over top of a wound, wrapping it. That certainly looks good, but it's only a barrier in trying to prevent any entrance of microbes into the wound. Certainly not having anything to do with the wound itself. Now that's where the RTD dressing certainly has all of its benefits. It is sold in a 4-inch by 4-inch square. You can cut that 4x4 into whatever size you require just to cover the wound. It stays in place for 3 days. Now that dressing, while in place, actually has a drawing, a vacuum effect from the wound into the dressing. This is unlike any other kind of dressing that has ever been used in medical science that I can tell. And this is why, because of that drawing effect, so many surgeons are now making a transition to using RTD dressings right there in the operating room. The last thing any surgeon does before he takes his glove off is put the dressing on and tape it in place. Well, RTD dressings are being the dressing of choice in majority of hospitals. We happen to have them here. One-of-a-kind opportunity. Take me up on it. There's a $25 charge for the actual dressing itself, but that dressing, because you can cut it and make it to order, is one that can last a considerable length of time. Of course, we do have the bioengineered algae concentrates. We do carry exclusively F3 at this time. Everybody's just getting started on this, and it does contain just about it's every single supplement that you ever would require, all found wrapped into one. We'll be talking more about it with Roland when he returns with us, as I've already mentioned. Roland Thomas is going to be our guest this month. It's going to be here on the 22nd. We got our shipment of DVDs and books. So we've got the book written by Dr. Michael Kiriak and Roland Thomas entitled Awakening the Genius Within. We also have the DVD, because we just got a shipment of those just last week. And so if you purchase the product, we'll give you free a book and DVD until we run out of them. But it will certainly educate you in a way that I think will make you appreciative of having the opportunity to utilize such a supplement and help you in your own personal quest to improve your health. Also, too, Simply Freeze. We've now, I think at this point, we are the one of the few retail sources and outlets in the country for sure. Hopefully, this will be found in Dick's Sporting Goods stores in the up-and-coming future. But until then, only place to get it. If you got muscular aches and pains, this stuff appears, at least as I've applied it to many of the patients who come into my office, something that gives them immediate relief. And if you're having aches and pains and looking for some sort of relief, certainly a way to obtain it. Simply Freeze. It's odorless, it's greaseless, and that certainly will give you that benefit. 4-to-1 oil. Boy, we have been pushing, have we not, the issue of putting down the fish oils. We have made the statement. We've backed it up and continue to back it up with scientific literature that fish oils are hazardous to your health. Now, many of you out there hearing that went, oh my goodness gracious, how can that be? Fish oils that I thought were so doggone helpful to your health. And I have to put myself on that list. Most practitioners are going to be on that list with me, supporting the administration of fish oils to just everybody, thinking that this was a wonderful way to get your essential fatty acids. Well, they're certainly comprised of essential fatty acids. The problem is they're too high up on the food chain of fatty acids. They are what our good friend Dr. Edward Kane called second floor, third floor, and not basement fatty acids. Turns out that a scientist back in 1994, name of Shlomo Yehuda, did do the research and determines now that the best way to attain your essential fatty acids of omega-3s and omega-6s is in a ratio of 4-to-1 of omega-6s to omega-3s, that the representative basement fatty acid, not second floor, not third floor, too high up on the chain, you got to go down to the basement, would be linoleic acid, and the basement representative of linoleic acid is sunflower oil. That's the omega-6. The omega-3 is known scientifically as alpha-linolenic acid. Tongue twisters. Alpha-linolenic acid, and those are the omega-3s. In the basement or first floor order of those, the supplements come in the form of flaxseed oil. And that ratio of 4-to-1 is what was determined by Yehuda to be the actual appropriate proportion that you should be taking in these supplements in order to get maximum benefit and maximum health improvement. Any other form causes disturbances in this proportion, and there are health consequences to pay for that disproportionality. I mentioned the other day, and some of you did respond, I have all the papers, at least in the abstract form, that have Yehuda-related material in terms of this 4-to-1 ratio. If you are scientifically inclined, looking for some support, some documentation, that there is there is a scientific basis to make a statement like there's now a appropriate way to receive your omega-3 supplementation. This all comes from the work, related works from others, starting with Yehuda back in 1994. We have all the abstracts. I'll be happy to give you a copy of the abstracts. Of course, by looking at the abstracts, which is usually a paragraph or two or three, you get the gist and the meat of the scientific research. If you actually want the paper itself, you'll be able to see exactly where to get it. You can follow up by getting the full article, the full research. But the abstracts are here, folks, and just send us a self-addressed stamped envelope, and we will crank them out and send you a copy of them so you have it in your own library, and many of you do have your own library with respect to all matters that are medical, and this is just the newest thing on the horizon. Essentially, two issues really have been brought to us over this time frame. One, okay, it's now known that a 4-to-1 ratio of omega-6s to omega-3s is the way to receive your essential fatty acids. And so that's one level of science that we introduced since, I guess, probably about the last 2 or 3 weeks now. And we'll continue to promote and support that premise. The other message we're bringing is the fact that there is harm to come from taking in other proportions and other supplementations of fatty acids, and in particular the fish oils. Now, I've been plowing through, and I've been going through Googling a whole bunch of topics when it comes to fatty acids and the role that fish oils play. In particular, the disturbance, as has been mentioned to us by Ed Kane, is that if you take high concentrations of EPA, you will disturb the proportion of arachidonic acid in the body, which is one of the major players, one of the major eicosanoids. These are third floor fatty acids. They play a prominent role in a bunch of body functions. And you go ahead and disturb that ratio, which should be 10% DGLA, 89% AA, which is arachidonic acid, and 1/2 of 1% of EPA. And it turns out that's a very delicate mantle and very easy if you take fish oil, which is essentially half and half EPA and half DHA. When you take these large concentrations of EPA, especially, you drastically impact on the quantity and amount and proportion of arachidonic acid, supposed to be 89% of the eicosanoids. If you consume EPA fish oils in any quantity, you disturb that 0.5% that it's supposed to be in total. Nonetheless, if it goes to 1% or 3%, it's not just proportionate that the arachidonic acid is going to slide by 1 to either 88 or to 84. It's going to go and drop to 70 and 60%, according to Edward Kane, and that will have devastating health consequences. And that is the reason why fish oils are a problem. Now, we never did talk about DHA, the other component of fish oils. In fact, I'll bring Ed Kane to talk about it and why that also has a health consequence to it. Turns out DHA, which is not one of the eicosanoids, only EPA is. And so it is not playing a role in disturbing that ratio of 10 to 89 to 1/2 that we've been describing. But DHA is excitatory and leads and can provoke seizures if in too high of a quantity. So another reason, a health reason, to not take DHA in such high quantities. And we'll have Ed Kane talk about that when he returns. And I'll bring him back in this month, the month of August, I promise. I was looking over and Googling up a whole bunch of articles, trying to find out some science that I could bring to you that supported what Ed was talking about. I found a number of papers talking about it. Here's one here. I just jotted this one down as I was going over them the other day. It's entitled Eicosapentaenoic acid, which is EPA, modulates arachidonic acid. This comes from a research done evidently from the island of Japan at a medical school called the Jeri Medical School, and these physicians who did this. This was done in January 11th, 1998. The results that the article said in summation, the results suggest that EPA is competitive with AA, arachidonic acid, at low concentrations, and that EPA may inhibit arachidonic acid metabolism via the inhibition of certain enzymes. So there's part of the science for why it is that EPA has a detrimental effect on the role of arachidonic acid. Then I found one other article that I'll cite to you now. This, oddly enough, was found in a bodybuilders publication called Athletic Age Nutrition, Strength and Science Weekly. This comes from an article of January 11, 2006. The phrase that I'll pick out of it, simply because it had a whole bunch to do with weightlifting things to begin with. The thing I pick out of it is this particular sentence: EPA naturally occurring in high levels in fish oil, and ALA, alpha-linoleic acid, which is flaxseed oil, occurring in flax. Both act, here's the crescendo phrase, both act as anti-arachidonic acid agents, and both lead to arachidonic acid suppression. It is that very scientific fact that appears to be well known in science that has a detrimental effect, and would be the reason that we should want to take the switch, move to 4-to-1 oil. We're carrying it here, folks. As far as I know, it's only manufactured by one company. It is the Ed Kane company. The company is called Body Bio. This particular product, Body Bio Balance, a oil in a 4-to-1 ratio, as we've already been talking about. Now, this is in a liquid form. It does come in a capsule form. We do carry that also for those of you who just can't handle liquids. But oddly enough, the conversion is it'll take 11 capsules to equal 2 tablespoons. This is the recommended dose. Either 2 tablespoons a day or 11 capsules a day to be equivalent. So we do carry the capsules if you are interested in them. Some people just, like I say, can't handle the liquid, but it's so easy to put this on salads or something like that that there should be no reason why you couldn't handle it. It's completely devoid of really any taste at all, certainly no pungent taste, but you can make your choices as to whether or not you'd like to purchase this in the form of the oil itself, 4-to-1, or in the capsules. But the problem is you have to take so many of them. Okay, let's do this. We're going to take a short break. When we return, I will have gone and found our guest for today. His name is Jeri Singleton. You all know him very well. We're going to swing to a discussion of MCG testing. I already told you, 25th of August for the first round. Hope we have our September date to announce when Jeri comes aboard. Be back in a moment with Mr. Jeri Singleton.
That we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asked you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit the Spirit. The blessings of Fruit the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHP 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. Here we are in a Monday version of the show. We've turned the page. We are August 1, folks. Summer's moving on, and we're finally moving on ourselves and bringing back a concept that we first brought to you back in February this year, a unique device, a unique testing. Was brought to our attention with respect to allowing you in a completely challenging and completely risk-free way to obtain the information that you would obtain if you had a full-blown cardiac catheterization on your coronary arteries. Now, we don't want anybody to ever have the cath, but to get that information is awfully important, to know your status with respect to how clogged up are those coronary arteries. Anyway, that's led to the use and now full force and reputation, my reputation behind it, a device called MCG. The company Premier Products and the representative, Jeri Singleton, he's been on the show many times before. He joins us right now. Let's say good morning and welcome back, Jeri.
How are you doing, Dr. Courtney?
We're doing well. We have made it to August 1. We are now in the month. We're going to be resuming finally after we had such difficulty procuring the product. I think, Jeri, we both should be getting some sort of a medal or something, be able to pull this off. It's been difficult, but we have finally procured the product, which is allowing you to return to my office. And as you said last time you were with us, the 25th of August is going to be when we resume our testing. Many folks out there, Jeri, received testing either February, March, or April, because those are the 3 months we did it. They have scored as they scored, and some of them are supposed to be retested in 3 months, others in 6 months, others in a year. And those in the 3 and the 6 month category have already called, Jeri. They're looking to be able to repeat the MCG testing again. Will you take a moment and tell our listeners what MCG testing is, what it's supposed to do, how it works, and you can probably get into this issue of repeat testing because that is what's going to be fitting the bill for so many of our previous testing participants who now have to come back and return. Why would they do that? Could you put that all in a little bit of a summation for us?
Sure. I appreciate you bringing that back on also, Courtney. I know it's been a little while, but absolutely I'm glad that contractually we got everything kind of ironed out. And to answer your question, MCG testing is a preventative diagnostic test for coronary artery disease or plaque accumulation in the arteries is how we typically think of that. And what we're doing is we're measuring any inadequacies for oxygenated blood flow, or ischemia, as it's known in the medical community. And we can do this in a very, we can do this in a very quick, accurate means, a 6-minute diagnostic test where we can collect the data in a resting outpatient setting, like in your office, Dr. Courtney, where we're gathering from 5 leads simultaneously. We're collecting measurements that we're then sending off for analysis and getting a detailed report on the patient's status with regards to ischemia. So from 0 to 20, we're provided a score identifying if there's some degree of coronary blockage there. It's going to reflect within that report. And the reason why that's so important is because coronary artery disease is the #1 cause of death in the United States. It beats all forms of cancer combined. It's also the #1 reason for emergency room visits. So it's a very, very widespread condition, especially in the Tri-County area, Fayette County, Allegheny County, Westmoreland County, right around in these areas. We have very, very high concentrations of it. And we've seen, since its introduction, we've seen a great amount of clinical data supporting the fact that this is an extremely valuable tool to patients because it tends to be a disease state that, again, not only is it so prevalent, but it also tends to associate itself with a low rate of symptoms. Or either very limited symptoms, no symptoms, or symptoms that can oftentimes be used with something else. So for those reasons alone, it's very, very important for a patient to be tested. If they fall into the appropriate category for this testing, and I think a lot of your listeners would, and then we can get very easily we can get back a lot of valuable information with regards to this, especially again if they have family history, if they have elevated blood pressure, hyperlipidemia, cholesterol, elevated cholesterol. They might have again women over 55, men over 45. Diabetics, all these higher risk patients. Again, genetics, I repeat myself there because genetics is one of the largest risk categories. Overweight, all these kind of things. These are all categories where patients should really begin to take a closer look at themselves. And I think with MCG testing combined with typical risk stratification strategies that you would offer, Dr. Courtney, and other physicians in our area, I think it can give us a lot of really valuable medical information.
Certainly, the information and having be able to obtain that information without any real risk to come to a patient, to get such valuable information with respect to how clogged up those coronaries are. And to do so while just lying on the bed in a 6-minute test where this device is sweeping you, sort of like an EKG does, which is strictly electrical impulses passing through the body. EKGs have been around since the 1940s, for God's sake. But this is the first real change, and I believe this is where the electronic age finally makes its inroads into medical science to bring us a completely new dimension. To think that electronic wizardry has come this far doesn't surprise me anymore, because every time we turn around, we're finding a new electronic application for something. Now to find it has really moved into the medical realm, and it's available in the local offices, in medical offices, and not have to have any risks associated with them all, I believe makes the MCG. By the way, MCG stands for what, Jerry?
It stands for multifunction cardiogram.
I hate that. I think it should be called something else. I don't really think that MCG does it, Jerry. But yet you and I have still not come up with anything to replace it yet. So okay, so we're going to call it MCG testing. This MCG testing is, by the way, it's insurance covered in most cases, is it not?
It is, and every I want to caution because every plan is different and. Every carrier is a little different, but absolutely, in general, it tends to be covered very, very well. Your Medicares, your Blue Crosses, on and on. So it has shown to be, and the reason that I believe that it's being covered so well is because it offers a lot of value to the insurers as well. And this is a conversation that we might be getting a little deeper into, but I think it's important to have and it's important to think about from a patient's perspective. Because, again, the typical testing that a patient would have if they have some of these risk categories, were concerned about themselves, with regards to their overall heart health, and might even have have symptoms or might be on some medication. Typically, they go through your stress testing, your cardiolite for Santine, your nuclear stress testing, or they might have in some situations a cardiac cath, full-blown cardiac cath. And, so this test very affordably offers the insurers a less expensive route for testing. It still gives us an enormous amount of data. Now every form of testing has some weakness. This test included, and the weakness for this test, the drawback is that the two main things that we can determine are if the patient has some significant degree of coronary occlusion, if there's some partial blockage in or developing plaque accumulation, atherosclerotic plaque accumulation in those arteries, we can very accurately detect that. Secondly, if it's there, we can put a severity, we can associate a severity to that. But the third piece that we can't unlock is which artery, which major or minor artery is the occluded or the affected artery. And that, if need be, there's other means to pick up and gather that data if necessary. But in most, for most of your patients out there, if they're thinking, okay, if I have this test, then what's it going to do for me? Again, assuming that it's appropriate for them and it's something that you've had a conversation with them and you think would be beneficial for them, we bring them in the office. 6 minutes, we would collect this information, and then we'll get back a very detailed report. Now, with that report, we can make adjustments to their diet and exercise regimen if necessary. If necessary, we can make adjustments to medication, supplements, other non-invasive therapies if need be, and that's where this really can be very valuable because every patient is going to have a different target range for this test. So, for example, an 85-year-old patient with diabetes and maybe some existing atherosclerosis isn't going to have the same goal in mind that maybe a 25-year-old would have. So when you're having that conversation, I think that's really where, Dr. Courtney, it's important to have those conversations. You and I agree on this one, post-testing, to really talk about what that score means, because then you can really begin to get into the issues and topics surrounding, okay, what's this score mean for me? Am I on the right track? Are things looking good for where I am and my overall health plan? And that's where I think this offers a lot of value.
Boy, does it ever. And I think very early on you learned how I felt about this. What are we going to do about the result thing? Okay, because I feel that the things that we have done here in the past continue to do up until whenever we met Jeri, but actually I find it to be a great way to add into my assessment of how well our programs are working. We have so many different ways to change outcomes, to make medical improvements, that it's just been a pleasure to have another very sophisticated means to know the status of someone as we originally start our relationship. Then we do this assessment. I recommend these are the things that you as a patient should probably pursue. And then we're going to go back and we're going to recheck ourselves to make sure that you have these improvements whenever the scoring allows us. And as I say, it's usually 3 different categories. You're at least at a minimum, every insurer who covers this allows patients to repeat this testing annually, at least at a bare minimum. And depending on how much plaque is discovered, then that has stepped up considerably to maybe even redoing the test on 6-month intervals or as many as 3-month intervals. Talk to us a bit about this repeat testing that insurers want to allow patients and the insurers themselves to feel good about doing the best job they can for their patrons and their policyholders on this retesting thing, Jeri.
That's a great question. I'm actually really glad you brought that up, Dr. Courtney, because some of your patients and a lot of your patients out there from your office and other offices across Allegheny County are probably thinking to themselves, okay, I've had this, maybe one of the few that participated in this already, and, if I've had this, why should I have it again? And where this is extremely valuable and it's in a different category than stress testing, ultrasound, coronary cath, all those things, is because the part of the technology of MCG, of multifunction cardiograph, is the fact that it's not only important to be tested, but retested. And the reason for that is because, mind you, we're getting a score back from 0 to 20 that we can track with you as a patient. And as you pointed out, Dr. Courtney, depending on their score, again, the score sort of dictates, give or take, but obviously the physician and the patient's medical history is going to play a big piece of that as well. But absolutely, some patients, they're simply going to need an annual follow-up on the MCG score. So, say for example, they're tested tomorrow, they come back at 2. This is all hypothetical. They come back at 2. You have a conversation with them. And you determine that you've talked about the right things to do over the next 12 months, with regards to diet, exercise, supplements, all those things. Then that patient may be very appropriate for an annual retest where you're tracking them to see, okay, are we staying on the right track? Are we following our plan? And is there anything that we should be concerned about 12 months out?
When you say 2, come back at 2, what you're really referring to is the score itself. So you already said the scores come back somewhere between 0 and 20, and we'd both admit that score of 0, 1, or 2 would be very minimal coronary artery disease, and that these people are doing quite well, and that just to continue to check on them to make sure whatever changes in the treatment plan we've had that could benefit them even more to lower the 2, because everyone that I meet with a 2, they're happy that they hear that they have a low score, but they're asking me, how do I even lower the 2, Jerry? Okay?
Absolutely.
Yeah, and I'd like to be able to tell them, well, just listen right here. Let me tell you how to lower that 2. And I think that's a really unique thing that we provide here, the fact that we're looking for improvements no matter what scores you have. But, of course, there are those that may score at the 5 level or the 7 level or the 9 level.
That's very true. In more cases, a significant percentage of your patient population is going to be your 4s, 5s, 6. They're going to be right in the middle or maybe slightly above where we would like them to be. It's just the nature and the statistics of our area, our demographics in this Western Pennsylvania area. And with those patients, again, they allow some patients are very appropriate for a every 6-month follow-up, where we need to keep an eye on them a little closer, just because they're maybe not in an extreme area of concern, but there's a little bit there that would want us to err on the side of caution and maybe set benchmarks within their goals or as far as tracking, that we would want to keep a closer eye on that to see if we're hitting our marks rather than an annual follow-up. And then lastly, you have your every 3-month patients or your 4 times patients that you would test on a quarterly basis, where they're going to be in a range where, again, you want to keep a very close eye on them, and you want to make sure they're doing everything they can with regards to lifestyle adjustments, diet, exercise. And then at that point, a lot of times those patients are already on some form of medication for either blood pressure, cholesterol, those kind of things. Maybe they're a diabetic. They're your higher, maybe your slightly higher risk patients, and you just want to follow them a little bit more closely and see what you can do to really monitor that score to maximize on their patient outcome.
All right, let's do this, Jerry. Let's take a short break. When we come back, I'd like you to explain a little bit about, when you say they do the test and then we send that stuff off to get analyzed and to score you. What does that mean? Tell us about that component that sort of goes unseen, but it's so fascinating to hear what is being done with that patient's score and how that's being determined electronically, coming back to us, in terms of how diseased they may very well be or how healthy they may be. Can you do that, Jerry?
Absolutely. Let's do that.
All right, take a short break. When we come back, Jerry's going to be talking about how these results get analyzed. By the way, Jerry, when we come back, we're going to talk about our date. We have a 25th in August. Now we'll talk about the September date, because you and I just discussed that before we went on the air. We've got Jeri Singleton with us, folks. We've got about 15 minutes left to go. If you have a question, you want to call in 412-825-6262. We will be back in a moment.
Want to help your family be healthier? Instead of learning to disguise tofu with wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruit native to the Holy Land with alkalizing minerals. Fruit of the Spirit, with 5 years of formulation, will work with a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how bad it is your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough that no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Here in a Monday morning version of the show, we're very fortunate today to have our special guest, Mr. Jeri Singleton. Been with us many times before, but we're retooling and we're getting things pretty much revved up to bring MCG testing in the office and literally have it here at all times. Jeri has brought us this technology way back in February. We've had multiple patients enjoy having the tests done and having plans put in play to allow them to change what may be the tip-off that things were going a little bit in the wrong direction. Anyway, Jeri, you're still with us, my friend?
Absolutely.
Could you take, well, let's do this first. We already had decided on, and we have, really this thing is filled up tremendously for the 25th of August. Just a few slots remain. And so, as to allow those who are listening to us today to pursue this, we still have a couple openings for the 25th, but we have a September date in mind, do we not, Jeri?
We do. You and I had talked about a tentative date for September, and I believe we pinpointed was the 8th?
September 8th. So, ladies and gentlemen, if the 25th is either full or it conflicts with your schedule, and August being a pretty big vacation month, which is understandable, you now have a second date that you can pick from. Be September 8th, and we'll be back here in the office doing these testing again. Whether or not you're a first-timer or a repeater, does not matter. It doesn't determine whether or not you get a slot. The slots that are open get filled up with whomever calls first. The number to do that, by the way, starting at about 9:05 today, is to get a hold of Kim, who's running this operation for me here. She's my office manager, 724-942-3002. Now, Jeri, when you had mentioned that we do this test, it takes 6 minutes, and like this electronic data is obtained, and then you say we send it off to get analyzed. Could you talk about that sending it off to get analyzed component? Because I think that's pretty interesting.
Absolutely, that's a great question too. Because a lot of patients, and I get asked this quite a bit by physicians on a daily basis as well, healthcare professionals, is okay. I understand the purpose of the testing. I understand what it's for, what it why we're taking it. But what actually is the process for report generation? What's actually taking place once we've, and again, 6 minutes, we've collected patient data from 5 leads simultaneously, primarily comparing lead 2 against lead 5 over that 6-minute duration, looking for imbalances for oxygenated blood flow. So what I mean by that, Dr. Courtney, is that you and I know that there's a tremendous number of arteries that encase, coronary arteries that encase our heart, and that provides the fuel, oxygenated blood to our heart. And there's major vessels and your minor vessels. Your left vein, your anterior descending. You have all these coronary arteries. You have a right branch, you have a left branch, and they branch off into smaller and smaller vessels. With that's kind of encasing our heart to provide every surface area there of our heart with that oxygenated blood flow. So when plaque begins to accumulate in one or more sites there within those vessels, they begin to narrow, and those arteries that narrow then have a harder time providing the oxygenated blood that needs to pass through them to transfer that oxygen-rich blood to the heart. When that's taking place, again, when one or more regions of the heart having to work a little harder, typically a neighboring artery is trying to compensate for that blood flow. It's trying to pick up the work of the less efficient artery, and in doing so, we collect those measurements from from the multifunction cardiogram. We collect that from the patient. And in most cases, the patient they don't feel this taking place, they don't know it's taking place. It's a very, very gradual disease progression. It's very, very common, and typically we all have some level of plaque accumulation, even if it's very, very minute. So when we take that data, to answer your question, what we do then is the machine itself gets plugged into a secure line where it transmits that data off to a server in New York. It runs it through 6 different mathematical type transformations. They're very similar to calculus-like functions, Dr. Courtney. And then with that, what it's doing then is it's processing it through each of these computational functions that have all been set up to identify that compensation. So, what we have is we have a 42,000 patient database, which is slightly increased from the 42,000. Which was I got the update from about a year ago now, so I think it's a little bit higher now. But we'll stick with the 42,000 number. We have a 42,000 patient database that have had this test done, the MCG, and they've also had a coronary heart cath. So they've gone up to their femoral artery or an artery in their arm, and they collected an angiography, or they with a fluoroscope, and they've been able, which is the gold standard for detecting coronary disease. Very, very invasive. It's very expensive. It has several risks associated with it. But nonetheless, that's how we collected our data in a very scientifically and clinically valid way. So with that, each of those 6 mathematical functions are identified against angiography or against a heart cath to be able to correctly identify some level of imbalance with regards to their coronary function. Now, the second piece, of this whole formula, after it's gone through those 6 functions, the final piece, then we get 155 indices of data relative to that patient, and then those indices are then computed against, once again, against that patient database of 42,000 to now provide a severity score. So the first step, again, is to detect that there's some imbalance present, and then the second piece of the equation is against that patient demographic, that 42,000 patients out there. We have men, we have women, we have 3 different continents of data collected, every age, every possible range of coronary condition, from no detectable level of mild, moderate, severe, all the way up the chain. we've had a very, very representative model of patients so that, for example, if a patient comes into your setting, Dr. Courtney, and they're tested, in theory we should have several thousand examples or possibilities to represent the different potential outcomes for that patient, so that we can very, very accurately identify what specific MCG score they represent and provide a very high degree of accuracy and confidence with that score.
Now, you just take data from, you say 106, how many different data points? 150?
I'm sorry, 166.
166 data points.
166, I'm sorry.
Okay, yeah. So this thing, as it sweeps you, grabs data from 166 different data points in the patient being tested, submits that then to compare it with the same data points in 42,000 others who've already had this test done, but also those folks have had a full-blown cardiac cath.
Right.
And
think of that as a control group. Sometimes that equates better for a patient if they think of that being the control. In this equation where we're solving for the unknown being the patient. So think of that 42,000 patient database as the control group built into the technology.
Well, it evidently turns out that by assessing these data points and then comparing to that database, that this is accurately reflecting the patient status who we're testing with MCG and lets us know whether they have, and to what degree they have, coronary artery disease themselves. And that's the beauty of this test, that without such invasiveness, without the risks associated with a cardiac catheterization, and those risks are many, it is possible to get the exact same information in a totally non-threatening way and then act upon that information way before any events ever occur. Because you know what? Nobody's stepping up and saying to their doctor, hey, I'm stopping in, could we schedule a cath? That's not happening. You end up being taken to the cath lab because you show up in an emergency room and you're having you're having an event, or you're having a group of symptoms present that are presenting queries to the medical people, and for that reason, the cath gets done. Now, Jerry, we got bongos in the background. I want to thank you for coming aboard today. We've now recharted our course. August 25th, folks, September 8th. Call up 724-942-3002. Let's either get you started for your first, or if you have to repeat to find out how well you're doing, do that today. Do it in the future. Jerry, thank you so much. Folks, we'll be seeing you on Wednesday with Dr. Vavavoom, Susan Smith-Jones. Until then, this is Dr. Dennis Courtney with Mr. Jeri Singleton saying so long for AM Impact on your health.